In today's Community Focus, we're talking healthcare spending with Andrew Ryan, the director of the Center for Advancing Health Policy at Brown University. Thanks for being here.
Thanks for having me on.
So you recently did a study about affordability standards here in Rhode Island, and correct me if I'm wrong, but I think we're the only state in the country that has an office of the Health Insurance Commissioner that oversees all of this. Just talk me through a little bit and talk our viewers through what affordability standards are.
Absolutely. So in 2010, the state enacted some novel policies that sought to limit the rates at which hospitals could increase their prices and therefore enhance affordability in the state, hopefully being passed down through lower insurance premiums for Rhode Islanders.
Okay, so you and your team took a look at all of this and how it's been working. What did you find?
So we found that over the long term, the standards did work to keep prices down, and this in turn ended up reducing premiums for many Rhode Islanders. So by 2022, insurance premiums were about $1,000 less than they otherwise would have been for many Rhode Islanders.
That's great news. And I know we've got some numbers that we're showing people on our screen here. $88 million in overall savings?
That's right. So those savings were focused on one part of the insurance market for individuals and smaller employers that purchase insurance directly through insurance companies, so they received most of the benefits from the standards.
So this sounds like good news for Rhode Islanders to get to keep some extra money in our pockets. What does this mean, though, for hospitals?
So hospitals certainly experienced revenue loss in the program, and so the larger clinical impacts of the program are something we did not study. That being said, some colleagues in Massachusetts studied administrative spending, which is some spending that hospitals have for things that aren't clinically related. And they found that Rhode Island hospitals increased their administrative spending less than Massachusetts hospitals at the same time, which suggests that the standards may have made Rhode Island hospitals somewhat more efficient, which would have limited the clinical consequences.
You know, we talk a lot here on 12 News at 4 and our other newscasts about the overall healthcare crisis that the state is seeing. You know, people having a hard time finding primary care doctors and finding other care, and also just sort of retaining those people as well. Does this factor into any of that?
So our study didn't directly assess the impact of the standards on healthcare supply or workforce. I mean, I'll say this is a problem in Rhode Island, certainly, but it's a problem in many other states. And so I think that the solutions are multifaceted, widespread, but you know, our evidence suggests that the standards have been good for workers and employers in the state.
Talk me through why you wanted to look at this and where do you think we should go from here?
Yeah, absolutely. Well, everyone's struggling with healthcare costs, and states have really taken a leading role in trying to adopt novel strategies. And states have identified hospital prices as a big part of what's driving affordability issues. And so Rhode Island was really a trailblazer in enacting these new price caps, but many other states, including Washington, Oregon, Indiana, and Vermont, have either passed recent legislation or have some pending. So I think you know, Rhode Island, all eyes are looking to Rhode Island, lessons from this reform to see how price caps and other strategies can make healthcare more affordable and without hopefully restricting access or having major clinical consequences.
All right, Andrew Ryan with Brown University, thanks so much for being here, and we will link to that study on WPRI.com.